Hello, welcome to the second episode of Closing the Care Gap, a Pinky Promise. Now we're going to be talking about the breast size. Does breast size matter?
Wow.
I'm looking at you because I'm coming to you. So I'm bringing it to Nene. So I want to ask, does the breast size matter? Like people walk into the NGO with, yeah. You say this one have it.
No. So honestly, I think that's the doctor's question. But from experience, I don't know. He would probably be able to give like more medical reasons to it. But I've seen someone that was very slim, very thin. So people like us that are very, we don't know. So I think the doctor would kind of help us.
Does it matter?
Yeah. Well, someone that is well endowed is not
well endowed.
He's being
very polite. We're talking about organic way here. You're saying well endowed.
It's not
like very civil. It's so civil.
It's not at a disadvantage.
Okay.
You understand? So she rightly said she has seen someone who is not on the big side coming down, with breast cancer. So it's not a factor of the size of the breast.
Yeah.
But, in diagnostic, in imaging, radiology, there is something we call the breast density. So that's what we look at. It's not as if even the breast density predisposes you, but it poses a lot of a challenge.
Okay.
You understand? So when you do the mammogram or when you are doing ultrasound, so it has a tendency to cover or to mask, or it reduces the sensitivity of the mammogram. So that's why when we do mammogram, we see that the density is is high. So we have to do other imaging modalities like ultrasound to double check that nothing is being missed. So it's not a factor of the size, but it's a factor of the breast density.
So you have it. If it's big,
no,
you're safe.
What's density? What does it mean in terms of what it's trying to say?
Oh, okay. No, like we talk, the breast have a fatty part, then it has a glandular part.
Okay, yeah.
So
sure.
the younger people have more of the glandular tissue.
Okay.
So as you grow older, or people who have breastfed, it undergoes fatty changes.
Oh, okay.
So if you still have more the components of the glandular tissue.
Okay.
So when we do mammogram, so if I just use the layman's language, is more whiter. What we say is more radio-opaque on mammogram. So it reduces the sensitivity of the mammogram.
Okay.
Then if there is a small lump or small area of the abnormality, it can mask it. It can make it difficult for us to easily see. So there is a worldwide categorization called BIRAD classification. So where we subjectively can classify or categorize the density of the breast. So once we see, depending on the density, we move on to do ultrasound scan to double check.
Okay, thank you. I'm coming to you. You're the next person I'm coming to. So thank you for bringing that up. I'm sure most people wouldn't have understood what he meant by density. Yeah. So he mentioned something about lump sizes.
Okay.
So coming to you with your number of years of experience in the lab, I know you've seen a lot.
A whole lot.
Like you have been through a lot has been through you. So now I want to ask you, what are the lump sizes you have seen in the course of, your day-to-day work?
Okay, let me start by saying that there's no day we come to work at SYNLAB that we don't receive breast cases. Let me put it that way. Either the whole masectomy or the lumps.
Ladies, you need to be checking
at all. Sure. There is no singular day at the least we've gotten in a day is 4. And there are days when we even get the left and right breast.
Somebody is breastless.
Yes. And for very young persons, even at age 18, I've seen 25, and I'm wondering what's there. But again, back to your question, there are different lump sizes. It could be peanut sized, it could be orange sized, it could be
as big as orange.
Yes, it could be as big as mango sized, depending on when the person either recognizes something is wrong there by checking, by doing the self-breast examination, or going to the hospital to see a doctor for a check. So there are different sizes.
Have you gotten as big as, let's say, watermelon?
I've gotten full breast as big as twice
Like the lump.
a
I'm talking of
watermelon.
a
No,
lump.
not lump.
Okay.
Watermelon is
Um,
quite big though.
Yes.
Yes,
I'm just-
the breast.
So that means
for
I see what you
watermelon.
did.
For watermelon, is
So
the breast
if-
we're talking
yeah,
about. But
what
for
she's
lump,
saying
There are different sizes of watermelon.
If you see a lump as big as watermelon,
And
how big was the breast?
Do you know what I mean?
Thank you very much.
No.
Now you said something about taking off both breasts.
okay.
So, Dr. Yemisi, sorry, let me ask: at what stage would a patient require mastectomy?
Okay, you know, the truth is that this question does not have the hard and fact rule. Before mastectomy, before the surgeon, when it's diagnosed, before the surgeon will say, okay, they will advise you to remove the ovary. It depends on many things. One, it depends on the size of the lump, relative also to the size of the breast. If the size is big, you know, if it occupies a 1/4 of the breast and it has not spread. Do you understand? So it depends on the stage. If it has not spread, the surgeon could advise that, okay, now people are going into what we call breast conservative surgery. Exactly. So
Conservative.
Yes.
They want
So
to
that
still conserve it
exactly.
after
So
removing it.
exactly. So if after removing a big lump, the portion that will be left is not significant, you understand? So they might advise that we do a whole mastectomy. But if it is detected early, so that's where, you know, the advocacy from the NGO is very
and
important.
not just that. That's where doing the BRCA test also comes in, especially for people who have relatives
A strong
who have
gene.
breast cancer.
Okay.
And so doing the BRCA test, which is breast cancer gene test, we also do that at SYNLAB with our quality procedures and protocols.
Okay.
It helps in determining who has the gene mutations, because with that it gives you opportunity to know whether you are at a higher risk of getting down with breast cancer. And then with SYNLAB's BRCA, we don't just do the BRCA 1 and 2. We also provide services for BRCA 1, 2, plus 16, meaning that we're not just checking the BRCA 1 and 2, we're also checking the BRCA, the 16 other genes, which will help you know whether you are predisposed to having both endometrial and ovarian cancer. So with that, it makes you to know that you are at a higher risk if the test comes out positive, and so it makes you
Take precautions.
early. Yes, early.
So what kind
Okay,
of
still on you, Ezinne. So, I know you mentioned some tumor markers
Sure.
earlier. Yes, you mentioned that, and you talked about blood tests that we can do. I know you don't do those blood tests to detect lumps. So
Okay.
please just explain what can people do to know that they have lumps. I know you also mentioned that sometimes it can be hidden.
Okay.
So what do you do to detect a lump in the
Okay.
breast?
To detect a lump in the breast, basically it's by doing self-breast examination. But aside from the self-breast examination, there is this tumor marker known as CA153. So when the CA153 is high, it shows that something is wrong somewhere. So at that point, the woman, or probably the man, at this case, should run to the doctor.
Okay.
Can I still add something?
Yes. Just
Okay,
briefly.
now detecting, that is where the issue of breast screening comes in.
Okay.
You understand? So this one, you have a tumor marker, you say it's positive, but we still have to try and determine where is it in the part of the breast. So breast screening is very important, maybe by
very key.
mammogram,
Okay.
yearly screening, or alternate year screening.
Okay, thank you very much. So before we finish this episode, I would like to ask Nene, how does ISO engage with patients who are interested in the foundations? How do you get your patients?
Okay, so we have a team that look out for people.
Okay, that's
Do they go to the hospital?
No, they don't go to hospitals. People have problems everywhere. It could be on social media.
How would they now find the people?
People.
It's very easy. People find us
But how
because
do
we're
you know-
online.
Okay.
So we get people call
Okay.
every now and then to
Okay.
say, oh, I'm
have this
having these issues, I
problem.
have this problem.
Oh.
The team also, if they see flyers or all this social media conversation that this person needs surgery and all that. Again, I said that we are heavy on partnership.
Okay. Yes,
So we
yes,
are
yes.
actually, so it's
yeah, you
very
won't have a
easy.
problem with
Exactly.
that,
We don't
yes.
have problems with that because we
Yes.
just go straight to
Yes.
the source. If we want to do something with a particular community, we look for like an NGO in that community to work with the person.
Thank you very much. This has been another exciting episode. Please do not forget, Ezinne mentioned that you have people of different ages coming in, as in their breasts coming in, not even them, coming in. So early detection is key. Please examine yourself, ladies. Examine yourself. Please, once again, do not forget to subscribe, like, share, and follow SYNLAB Nigeria on Spotify. My name is Uchenna Amadi, and we'll be right back.
Thank you.